I'm a gynecologic oncologist. So I take care of women with gynecologic cancer, both surgery, chemotherapy, not boarded in palliative care, but we do practice a fair amount of palliative care as well, and survivorship care, as well as managing patients with high-risk inherited genetic cancer syndromes. I think the complexity of the human body is fascinating. In my particular field, I take care of pretty sick patients, and so I am fascinated, intrigued, and sort of challenged by their medical needs, understanding them, and sort of meeting them where they are and carrying them forward. I tell my patients I cheat. I always sort of thoroughly review everything that gets sent my way so we can minimize the amount they have to repeat and really focus on what they want to tell me. The first thing we do is, we make sure we're on the same page. Do they understand why they got sent to me? And what does that mean? I will then usually give them broad strokes of how concerned or not concerned I am. Sometimes we have a diagnosis of cancer when we meet. Sometimes we don't. Sometimes people are referred for non-cancer diagnoses, more complex issues. So I promise them when they leave the office, they're going to have sort of what are my next steps in my hand. And then we focus on just crossing that next bridge, and then we'll reconvene when we get that next set of information. So I promise them that they will always get the honest answer from me, and they'll always get that answer as soon as I have that answer. I'm a firm believer that nobody wants to sit at home and wait for results, so they'll get them as soon as I get them. We're going to be partners in their care. I will be honest and upfront. I tell patients that my job is to go through the myriad of literature, give it to them in, non-medical language, and offer them sort of best recommendations. And it's their job to tell me what is, acceptable and reasonable for them in terms of care as well. I talk about it as a journey, and I tell them I'm going to walk with them on this journey, whatever that means and wherever that takes us together. I have 3 young kids, and mostly that, outside of that, exercise. My husband and I joke that's how we sort of hide from our children. So exercise has always been a hobby of mine. Right now it's mostly cycling because it's too cold and icy to be running outside.